Kia ora. If you're a woman in midlife, this podcast is for you. Get ready to embark on a transformative journey where we tackle self-doubt, people-pleasing, imposter syndrome, and overwhelm. Celebrate this second stage of life and claim your authentic confidence and courage. Midlife is not a time to settle. It's a time to unleash your purpose into the world. Make an impact done your way without compromising your own well-being. I'm Megan Kerr, mindset coach, former psychosynthesis counsellor and craniosacral therapist. Are you ready? Let's begin. Hey, welcome to the podcast. We are gearing up for our wonderful summer holidays, Christmas and New Year here in New Zealand. Long school break for all the kids, not so much for all the mamas. My kids are much older now, so it is a bit of a break for me as well. And I've decided to take my own advice and take just 3 weeks off creating brand new podcasts. But fear not, because I'm bringing back my most favorite informative interviews that I've done over the past year with health professionals. To kick us off, I think this is one of the most valuable podcasts in my library. It's an interview with the amazing, intelligent, incredible Catherine Keenan. Catherine's a local pharmacist and women's health advocate, and she allowed me to pick her brain, learn as much as I could learn, all about body identical HRT and all forms of HRT actually. And really we uncovered, Catherine uncovered for me, why when we think about HRT now, it's very different to how we were thinking about HRT 15, maybe even 10 years ago. And how some of the health professionals that we might speak to in our perimenopausal journey may not be as up to date as what we want them to be. And that covers mainstream health professionals as well as complementary alternative health professionals in more of the natural healing fields. There's so much new research around now regarding body identical HRT, its safety, its efficacy, and the symptoms that it treats, that I think, whether you're a naturally inclined person, as I have been in my life, or not, I think it's really important for us to look at it if we're having any of the perimenopausal symptoms that can be physical, mental, or emotional. I think this is such a great podcast that answers the question, body identical HRT or HRT, or now it's called MHT, menopause hormonal therapy. Is it for me? What are the risks? What do I need to think about? And how do I advocate for myself? Take a listen to the episode. It's packed with so much vital information for us as women in midlife. And I want to just let you know real quick before we jump into the episode that we're enrolling for the next round of the Midlife Upgrade course. The Midlife Upgrade course is my answer to the challenges and symptoms that we experience as women in midlife. This is a psychological roadmap for women in midlife. It is a group coaching course. There are video modules and learnings online all ready to go for you. And then we have our weekly group live coaching calls, which are just the golden nuggets of the course. If you want to take charge of your life, if you want to turn this season of your life into the upgrade that it is meant to be, take a look at all the details on my website, megancare.co.nz/course. And now, on with the show. I am super excited to be speaking with Catherine Keenan today. Catherine is a pharmacist. She is the owner and founder of Vivian Pharmacy, She manages a team of 20 staff within a busy 7-day pharmacy and medical centre in Vivian Street, New Plymouth. She is a wealth of knowledge, and she is going to speak to us today all about HRT, perimenopause, menopause. I am so looking forward to this talk. So, Catherine Keenan, thank you so much for joining me on the podcast. We are talking perimenopause, menopause, HRT, bio-HRT, all of the ins and outs around that. Thanks for joining us.
No worries. Excited to be here.
You have an interest in women's health. We've chatted about that.
Yes.
Yeah. So what sort of stimulated that journey for you in terms of this phase of life, perimenopause, menopause, midlife?
Yeah. So having been in the health profession for, over 30 years now, I guess you identify with the stage that you're at in life. And, before I had kids and everything, I thought I knew everything about being a mum, and then suddenly you're a mum and you learn different things. And I think for me, this interest has always been there in the health journey of women. And I've really investigated, selfishly, they call it me search, stuff that pertain to my stage in life. And, 10 years ago, I was really struggling and thought, what's going on? And so just, piqued an interest in me. And then I talked to a lot of women that I deal with in our practice and friends. And no, I think holistically, I've just looked at all the different options. And so I am a woman. So obviously the health of women is important. And then I've just pertained it to my stage in life as well. So being in my mid-50s now, I just, I've found some really good answers for myself, and then I think just wanted to shout it from the rooftops, really. So,
and honestly, we need it. The amount of conversations I have every week around this phase of life in perimenopause and menopause, it's just so needed. Let's kick off with the first question. So, tell me what is the difference between bio-HRT, regular HRT?
Awesome. Yeah. So obviously, for the listeners, HRT means hormone replacement therapy. So, when we're going through perimenopause and menopause, that's those symptoms that we get are related to hormones starting to decline. And that happens in different stages for every woman. So what the hormone replacement therapy does is try and replace the hormones. So there's bio-HRT, there's body equivalent HRT, and then there's other HRT. So the most common one we see now, and must say certainly the best one, is the body equivalent HRT. So that's the ones that are in the patches. There are gels available overseas. So your estrogen will come in a patch or a gel. And the progesterone will come as the micronized progesterone, which is in New Zealand, the funded brand is Utrogestin. So that's your body equivalent. And then there's bioequivalent, which have a very similar structure to the natural hormones. Sorry, the body equivalent ones are exactly the same chemical structure as the body hormones. So the most natural way you can get it. Sorry, didn't cover that. Bioequivalent have a similar chemical structure, but may not be exactly the same, and often are made in a compounding lab. And then you've got your regular HRT, which is synthetic HRT. So chemically based compounds that supposedly match, but are not the greatest. And so we can talk about that a little bit further on. But that would be good. So the most natural, body equivalent, trying to be pretty natural, bioequivalent, not natural at all, regular HRT.
Okay, so when I say bio-HRT, I'm actually meaning body equivalent.
Body equivalent.
HRT. Okay, good to know.
I mean, a lot of women, or you'll hear podcasts and they'll talk about the bio-HRT. Yep. And they kind of mean body HRT. So it depends the person talking, if they've got more of a medical background, will definitely say the body equivalent. Maybe haven't had the medical training, might just call bioequivalent and try and mean body as well. So there's
sure.
Yeah.
And so what are from your perspective or from your understanding, what are some of the most common symptoms that you would see that body identical HRT or HRT can help with?
Yeah, so as hormones decline, our bodies can show many symptoms. I think, in one of the most recent trainings I did with my staff, I sort of wrote all the symptoms I could find, and I got to over 20.
Yeah.
There's, and I think that's probably a lot of the issue is there are a lot of symptoms related to hormones declining. So we know about hot flashes. We know about night sweats. We know, the anxiety, maybe feeling low mood, lack of sleep, which can relate to the night sweats and hot flashes. But things like vertigo, joint pain, just general fatigue, and all things that you think, oh, I'm just having a bad day or I'm just getting older, actually is because your hormones are lower. So when your hormones decline and you get the symptoms, if you replace your hormones, a lot of the symptoms will go away. So I can list off, joint pain, fatigue, irritability, low mood, low libido, vaginal dryness, your hair starts falling out, you get heart palpitations, breast tenderness, headaches, irregular cycle. So, there'll be women out there going, that's me, like it's, So all those things that, make you feel like you're just having a bad day or a bad moment, or it's all just in your head, actually could be your hormones. Yeah.
And so that,
HRT will help with those.
Right. And so that is a good time to start when the symptoms start. So not necessarily once you're through perimenopause, once your cycles have stopped, but actually once the symptoms are showing themselves.
100%. You don't have to wait till you've got hot flashes to get hormone replacement. It may be harder to get it because your doctor will look at other options or talk to you about, could it be hormones? I think sometimes they fall into the trap of a blood test, which may not indicate the true nature of things, because that's just a point, you go and have that blood test. So at that very minute, at that time that they took your blood, that was the hormone level. But 3 hours later, it could have gone down, or, because it's fluctuating so much when in the early days. So I think you just have to keep a diary, on apps or whatever, and just, is it cyclical in the early days? But you can use hormone replacement early on to help, and women do. We're seeing that a lot more now, even if their cycle's still there, if they're still bleeding, even if it's only every 3 months or every 6 months, or heavy 1 month and then really light the next, or it's changing. That's a real good indication that something's going on with your hormones.
So good to know. And so you talked about the ways we can take it. So it's the body identical HRT. So that's the patch and then the capsule. So is that all that's available to us in New Zealand specifically, or is there more?
For body identical, So in the UK, and actually I see recently someone is trying to push to get the gel funded here. So the Utrogestin only got funded since December last year,
so
I
saw that.
So behind. But so yes, Utrogestin and the patches are the body identical ones that are funded in New Zealand, prescribed. And then you've got Ovestin cream, and that's just used vaginally. And then they also make Ovestin tablets, which are body identical estrogen, but you take it orally, and that opens you up to more side effects because it has to go through your liver. whereas the transdermal straight into your bloodstream. Yeah.
Yeah, so it doesn't have to go through the liver. Yeah.
First pass effect and less chance of blood clots, all the other issues that go with oral HRT.
Yeah. So random question is, I've been seeing some, quite a few posts around shortages in the UK. Are we likely to get shortages here? Because I noticed there's already been when I get my patches, they're like, oh no, we haven't got them. You have to have these ones, or you have to cut these ones in half. And
I know. Yeah. So yes, there's a worldwide shortage of estrogen patches. There's a shortage in the UK at the moment of Utrogestin, so we're keeping an eye on that. At the moment, that's not an issue in New Zealand. At the moment, Estradot is the gold standard brand. That's the best brand. We don't have any issues with that, with sticking, and that's the gold standard. That's a brand we can't get at the moment. So there is two other brands on the market at the moment we're having to use. Not as good, still effective, but they don't stick as well, and people are reacting to this adhesive. You can cut their estradiol. So we're hoping that's coming right about July, August. So
good.
There should be supply enough to get, but you'll have to pick it up monthly so that everyone's got a chance.
I've noticed
you can't stockpile.
Yeah. Not allowed to stockpile.
No, yeah.
So it took me, so I went through early menopause and I did all the natural, all the herbal, all the sort of complementary avenues, and it did help. And I was very resistant to HRT. And I've got to say, mainly because I'd heard about that study of, I'm not sure how long ago it was, that HRT was maybe not good for women. And I sort of have a leaning to more natural, pathways. And then I actually saw a woman who went through the same thing, and she recorded a video and she said, look, I've resisted this for 10 years and I finally said I'm going to try body identical HRT, and it's completely changed my life. And that opened my eyes up. And I went and talked to my doctor and, sort of went down that path. Where was I going? Oh, so talk to us about herbal support versus the body identical HRT. Benefits, pros, cons.
There was a lot in that, Leiden. So there's herbals. I'm just going to write myself a note. Herbals. There's the Women's Health Initiative study, and then there's support of if you're already on body identical and still want to take some herbal products. So we'll talk about herbal products first. I feel like a holistic approach. Every woman is different. There's not one size fits all. You do have to know your body, listen to your body, document your diary down your symptoms, know what is happening for you. So then you can work out what's working and what's not. If you try 6 things at once, you're never going to know what's working. So start slow. Try, I'm totally open to herbal products. I think, there's a lot of benefit to be made from a lot of these things. A lot of them have the phytoestrogens in them. So that's the black cohosh. They're not going to come to me and blow it into my brain, but red clover maybe. I know you've had some naturopaths on, so they've probably talked about it. But so they will mimic a bit of the effect of estrogen, but they're not estrogen. So you're not replacing your hormones. You're, trying to get some sort of mimicking. So you will get some benefit, especially early on. You might get some help with a little bit of the flashing or fatigue or headaches and things. And they're often in with other good energy boosting herbs and vitamins. So, you totally get a good practitioner, talk to them, work it through. Yeah, I think start slow, try one product at a time, see if it works, then either move on or add in. But yeah, I just don't think to do 6 things at once helps anybody, and it's a lot of load on your body. Yeah. So find out what works for you, and and then once you're on the body identical HRT, there's all the good things for helping with your health, like B vitamins, magnesium's awesome. What else is, fish oils, like all those good, healthy stuff. No problem taking those with your HRT. So, I just would be careful about adding in the phytoestrogens on top of other estrogen. You feel quite sick. You'll probably get a lot of nausea. And also, again, they're not through the skin, they're through your tummy. So then they've got to get absorbed and metabolized and excreted. So your liver and kidneys and everything having to manage it. So it's, just another load on the body. So just, be careful about the phytoestrogens adding in with the HRT, but all your other supplements and supports, great. Yeah. Does that help?
Beautiful. Yes. Yes. Very helpful.
Yeah. And then the Women's Health Initiative study. Ugh.
Yes.
So I guess the short answer to that is it was done on older women. So they were predominantly over 60, had been through menopause, probably most of them 10 years. Then they started on HRT. The HRT they put them on was synthetic. It was made from horse urine. It was the only thing available in the 90s. So the study was done predominantly through the mid to late 90s. The findings were reported in 2002, I think it was.
Yeah.
And they showed that there was an increased risk of breast cancer being found. So from what I can gather, the estrogen didn't cause the breast cancer. It just made already cancerous cells grow more. So they were found easier. Does that make sense? And it was from something like 2 in 1,000 to 4 in 1,000. So that was the increased risk. So they say it doubled from 2 in 1,000 to 4 in 1,000, something like that, but still was only 4 in 1,000. The risk was really still quite low. So, I mean, it's been totally annihilated, that study. I think we've had one person stay on that synthetic drug. We dispensed it by the thousands in the 90s.
Right.
You just wouldn't use it now. You'd never start anyone on that. it's rubbish. So,
Just to put it bluntly.
I mean, estrogen, like I said, is it's a growth hormone. So, it's good for your bones, it's good for your heart, it's good for your brain, and the way that it's promoting, cell renewal, and it's good for your hair and your skin and all these things. But then if you've got some cancerous cells, unfortunately, they're going to grow a little bit more too. So, but there's no increased risk of death from breast cancer with HRT. You might have a slightly tiny increased risk of finding a cancer, but detection's really early now. Treatments are good. Yeah, I think it's just a conversation people need to have. I have a strong family history of breast cancer. My mother died at 47 and my grandmother at 65, both of breast cancer. And I was very reluctant because of the study. And again, I went to my GP and I'd done my own research. And, my GP, luckily a woman the similar age to me, she just said, what are you doing to yourself? Why are you suffering? Why are you, like I was in a pretty bad space. Yeah. And she said, why are you doing it to yourself with a very slim chance that you're going to get breast cancer? Because, you're getting yearly mammograms. You're very aware of what's going on with your breasts. Yeah. So, yeah, and so try it. She just said, yeah.
No, you
just said try it and change my life. Yeah.
Well, that's what I was going to say is that struggle of years and years, and it could even be, it is longer in terms of our quality of life. When you weigh it up, that's an important thing to do. So that study has pretty much been debunked, right?
I mean, it showed results for what they used at the time. A, those drugs aren't used anymore. B, the women that were using them were at a higher increased risk of breast cancer anyway because they were older. the highest risk of breast cancer is age. And then they never took into account the fact that maybe they were still all drinking alcohol and not eating well and maybe not exercising and all those things that can actually add to breast cancer risk as well. So there was just so many things that were wrong with it. And the media and dare I say it, male scientists decided to grab it and said, these women should not be on HRT. And
no HRT.
There's studies coming out now about body identical hormones and estrogens having such protective and life-changing effects for women that it just poo-pooed that whole other study, basically. Yeah.
So first of all, that's so good to hear around in terms of that study, because when I was labouring under the information from that study for probably 7 years. I went through early menopause for those first 5 to 7 years.
Yeah.
And so that's me. How many other women are doing the same thing, right?
Oh, just had one last week. She had a hysterectomy. She's in late 60s now. Hysterectomy, got given hormone replacement, felt amazing, and then got told, no, this is dangerous. You have to stop. You can't be on it any longer, and got it whipped away from her. And so she has had 15 years of hell and now is being offered her hormones back. And, you just think pretty sad really sometimes. Yeah. And it's pretty mean.
There's a big picture there, hey. And then you just also talked about the protective aspects of it. Can you speak a little bit more to that? Because I was actually surprised about that, having not had any knowledge around it, but I think it's really important.
Yeah. So, this is all new stuff that's just coming out in the last 20 years because of the body identical hormones and the fact that women obviously are living longer and, the most common cause of death in women is cardiovascular disease. So, that's the most common cause of death. And what they've found is that estrogen protects your blood vessels, cardiovascular, your heart health. It protects your brain. It can reduce your risk of type 2 diabetes and definitely protects your bones. So, so when you lose your estrogen, you can get brittle bones, heart valve problems, palpitations, and, you get the foggy brain. We all know that. And then obviously there's dementia risk as well. So they know that now and that's why it used to be you couldn't be on HRT longer than 5 years, but that's definitely been reviewed as well. And they're saying now there's no reason why women can't stay on HRT their whole life.
Wow.
Yeah. And as long as you're keeping, you look out for, reporting any side effects.
Sure.
Checking for breast cancer risk.
So for me, a woman of 52 who's been on it for a couple of years, because this was something that came up in the talk that we did, women were saying, you can only be on it for 3 years, you can only be on it for 5 years, the body identical. I was like, well, I haven't been told that. I don't understand that. So you're saying what the research that's coming through now,
that we can why. And that again relates back to that Women's Health Initiative study, because what they found was that obviously the increased risk of breast cancer when that synthetic hormones, they found the risk was increased after 5 years or women were over 60 because but it wasn't the trend, it wasn't the body identical hormones, it was the awful hormone, and also they were older anyway. So I don't know of many women in that study that were under the age of 60, whereas now we're saying start them early, do the body identical, get the dose right, protective effect, stay on them.
Beautiful. And there's no, so if I'm on, say is it 25 mgs for the patches?
Yeah.
If that's keeping my symptoms, if that's keeping things settled now, there's no particular reason or no expectation that would change, like I'd have to take more as time goes by, in your experience?
Doesn't seem to be.
Okay.
They tend to start you on the lower dose and then give it about 5 to 6 weeks to really decide if that's working. So it'll take a few weeks for it to build up to a level where your symptoms will be under control. And if they're not, then they'd look at increasing your dose. So then you'd go to a 50, try that for another 6, 7 weeks. And then again, go to 75. We've got a few women on 100 micrograms. It just depends on you and on your symptoms and how your body processes it. And for me, I tried 25, went pretty much after 6 weeks, went to the 50, and then I thought for a while, oh, maybe I'll try the 75 and see, because I felt amazing on the 50. I thought maybe I'll feel more amazing on the 75, but didn't quite work that way. And I got some side effects and breast tenderness and felt hormonal, like I felt it was too much. Like, when you feel hormonal. So I just felt, went back to the 50 and pretty much
sweet spot.
Go with that. Yeah. And just wanted to mention about the progesterone, because not all women will be on that, the micronized capsule, because they may have a Mirena in. Right. So the intrauterine device, like an IUD Mirena, that's implanted into the uterus and slowly releases the progesterone. So if you're on the Mirena, you can just use the patches. You don't have to take oral progesterone as well. And if you've had a hysterectomy and had your uterus or womb removed, then you don't have to take progesterone either, because the reason you take progesterone is to counteract one of the side effects of the estrogen, is that it is a growth hormone. So it will make this lining of your uterus grow too much and can cause complications. So you take the progesterone to counteract that buildup of cells in the uterus.
Oh, right. Yeah. That makes
sense. If you still have a uterus or womb, then you'll have to be on progesterone as a protective effect.
Right. Beautiful. And so I was talking to a friend, and she started on Body Identical, the patches and the progesterone. And she said it was just like a light went on, and I could kind of see again. I could see my life again. So, that increase in vitality. But she said, I've had fibroids, and I started to get pain pain like down my leg, and it started to feel weird, and I just didn't like it. Can that happen? Because I just sort of Googled after we had that convo in terms of fibroids.
Yeah, I mean, I guess it's getting the dose right. It would just be particular to her symptoms. So you'd probably just have to get an ultrasound to see what was happening with the fibroids and see there's a chance with the estrogen that they could be flaring up. It depends where she was in the cycle and things. Women do still use Body Identical HRT with fibroids, but if you're getting symptoms like that, obviously that's going to cause you some anxiety. You definitely need to get some investigation done if you can get an ultrasound to see, and maybe it puts your mind at rest. Sometimes you do get the odd twinge and and you think, I wonder what that's all about. Yeah, I think if it's worrying you, you should get it looked into. There's no reason why you couldn't stay on your HRT, but you just have to get the right advice.
That's good to know. Yeah. And so to that, I've myself got a fabulous GP. They're really up with it. But generally speaking, if we go to our GP and say, I'm irritable, low mood, bit more anxiety, maybe a bit of hot flashes, are they in the know around Body Identical HRT? Is this a common thing that is prescribed to women in perimenopause in New Zealand?
It very much depends on the GP.
Right.
It depends on their knowledge and their willingness to listen and learn. I would say probably 5 years ago, if you went saying exactly what you just said, that would have put you on antidepressants. that doesn't replace your hormones, and you just, probably don't feel any better, and then think something wrong with me. I'm quite strongly advocating through GPs if I can. If people want, I get the GPs to ring me, or I'm happy to send email links to articles, research, and things like that, because I think if women don't feel they're being listened to, maybe they need another advocate in their life to help. And I think that's the thing. What I found once, it's funny because I needed to have my voice at the GP. I needed to have my voice so that I was listened to, but you don't feel like you have it when you're in with the symptoms, because you're anxious and you're sleep deprived and you're just shitty at everybody. Yeah. And, you almost have to fight for it, and that's not really right. But then once you get the clarity, I don't know. I just, like I said, it's a terrible from the rooftops.
It's a terrible irony, isn't it? Like you're really needing it, but it's at the very time when you don't have your voice, your confidence is lower. You've got brain fog, all the rest of it. Yeah.
And actually, one woman said to me, she said, looking at it from the point of view of grieving, and I'd never really thought about it like that. But you're no longer able to reproduce. You're no longer able to have that function as a woman, to have a child, because you no longer have a cycle or whatever once you're through that. And she framed it that was a real grief for her. And I'd never really thought of it like that. But I think everyone has to find it's, and great that we could have a conversation about it and talk it through. And that's why I think you need good mates, good family support. Bless my husband for putting up with me, goodness, and I've had women come in and say, my husband thanks you for, pointing me in the right direction here, because, I feel like you just want to, get rid of everybody. It's awful. So I think, back to that, speaking up to your GP, it's quite hard because some women don't have the voice at the time. And if the GP says, just try these, antidepressants or whatever, and it's getting better, it's very simple. At this time, you're starting to lose your hormones, or you've lost your hormones, you need them back. And that's pretty much all you need to say. And you hope that they'll listen. And if they don't, get a second opinion.
Yeah, good call. Yeah.
One woman had been to a male doctor who said, if you were my wife, I wouldn't let you take it. And I just think,
seriously,
what? It's and so you think that's not a new Plymouth, by the way, but it's it's just that whole mentality of fear,
that in a
protective kind of way.
Well, yes, but it still pervades, doesn't it? And I have also, I have talked to some complementary health practitioners who were still citing that study as to why we shouldn't be taking body identical. And so it is, your voice is so important. I tell as many people women as I can about it, so that they, we know we have options and choices, and we have an understanding of what we can take to support ourselves.
That's right. And like I said before, it's not one size fits all. I think, when you go through menopause, perimenopause and menopause, like previously women never lived that long. They just didn't even know about it, So now we live longer, we have all these health interventions that we can do. And so actually it's almost like you want to embrace this new phase of your life, and you want to be able to do it with vim and vigor,
Exactly.
You want to be having, great relationship with your partner, and and I think it's, HRT can really even things out.
Yeah. And, for a lot of women that I've talked to, and for myself, where I was going through that phase where I had to be so careful about my health and my energy. And, if I did too much one day, I was pretty stuffed the next day, and, all that kind of stuff. And it did give me so much more vitality back in those early months. It still has, but I've become much more used to it now. It's just every day now. And so, I'm 50. Hopefully I'll live a good while longer. But now that, if I don't have that quality of life, what kind of life is it, And it's not just physically, it's emotionally and psychologically as well.
And that's, all those things that make you able to make good decisions and eat better and exercise and, be happier and enjoy life. That lowers all your risk of all your other things as well, like your heart disease and breast cancer and everything. So there's sort of there's the clinical benefits, but there's also the psychological whole life benefits as well. So, I think along with HRT, it's just really good to take stock of your life and just think, have I been self-medicating with alcohol or recreational drugs or 10 cups of coffee or something like that? Once you get the HRT, those sort of things, you don't have to self-medicate to get sleep or get through a stressful time because you've got other things on board.
They can, exactly. And they can fall away. Those other things can fall away so much more easily because we're resourced in that other area.
100%.
Sleep was such a big thing for me that changed with HRT. And I was like managing it and I was like, it's okay, I can meditate, I can but that's such a lot of managing that I was having to do. And now I'm like,
amazing. I know. So the sleep is insanely good. And that's the thing about progesterone. If you're taking the micronized progesterone at night, it does have a mild sedative effect. It's not knocking you out, but it's just calming and relaxing and it's so much better. And then you're not getting the hot flushes and night sweats because you're on the estrogen. It's it's great. I mean, I still have the odd like sleep drops or of course I have the odd glass of wine, but I think it just keeps you even.
And I'm not expecting to wake up at 4 a.m. anymore around it. Without not being able to sleep. And so for the few women that can't take it, and I have talked to one or two that have tried through their doctor to take it, and one had quite bad reactions to it and was told, okay, maybe it's not for you, but really feels like she needs some support. What are some alternatives? Are there alternatives?
Like possibly not hormone-wise, if it's the hormones themselves. And some women are just really sensitive. They just get all the side effects and not much of the benefit. And it's pretty rare, but it can happen. I mean, I guess don't give up after the first lot. Maybe look at some dose adjustment or start really super low and then to slowly increase it. But, if it's not for you, then just really keep that diary of symptoms, and then you'd look at how can I manage those symptoms. So joint pain, like regular exercise, strength, try and get your strength up, building muscle, protein in your diet, all that. Just tailoring the treatment to your symptoms. So you might just need to be on regular paracetamol for that, and trying the things for vertigo or the hot flashes is tricky because, you can try herbal things if they do help, but generally you will just need estrogen for that. Vaginal dryness or painful sex, Avestin cream is life-changing. Increased UTIs, that's quite a common symptom, particularly in like women we're seeing, between 60 and 70, they start to get, that vaginal dryness and then increased UTIs, and just some Avestin cream twice a week, just locally, and you get minimal side effects with that because it's just working in that local area. So I think it's just finding a good practitioner or, someone to talk to about it and just diary the symptoms, and then they can tailor some treatment to that.
Getting specific onto the symptoms.
Symptoms.
Is there anything we've not covered that you want to speak to, Catherine, around this?
There is a lot of information out there, and I think just, look at your sources, I use Dr. Louise Newsom in the UK has been amazing. She's got the Balanced Menopause website and app. There's heaps of really reputable research on that. She speaks to some great people. I think that's a really good place to start. And there's an app, you can just diary your symptoms every day. And then you can go to your doctor and say, hey, this is what's happening. I think that's it. Just, think of it as, you're deficient in hormones and they need to be replaced. It's like you're deficient in your thyroid hormone, so you take thyroid hormone to replace it. When you're diabetic, you don't have insulin hormone, so you have to replace it. So I think, don't think of it as that you just have to suffer through, that there's, you have a deficiency in something that can easily be replaced and in most part very safely.
Beautiful. That's very, very clear. Thank you so much. And hey, look, really appreciate you joining me on the podcast. These are all the questions I didn't know the answers to, so appreciate you being here so much.
No problem.
Hey, last very random question. What's your current favourite book?
The best book I've read lately is that Lessons in Chemistry. I don't know if you've read it.
No.
Yeah, I can't think of the author.
I'll put a link in.
It's coming. Lessons in Chemistry. It's coming out as an Apple TV series with Brie Larson. It's amazing. It's empowering for women. She's a scientist in the 1950s and 60s who gets a whole lot of shit from a whole lot of blokes, and she doesn't take it, and
we're onto it.
It's amazing. So I recommend Lessons in Chemistry.
Thank you very much. I'm into that. Totally. Yeah. All right, Catherine, thank you so much for joining us on podcast. You've been amazing. Have a good rest of the week.
Awesome. Thanks again for having me, Megan. Cheers.
Hey, thanks for joining me on the podcast. Really appreciate you. Check out my course where we just go so much deeper than I can ever do on a podcast over an 8-week period. The Midlife Upgrade course is a blend of video and learning modules and weekly live calls where you will discover a roadmap for psychological freedom in midlife. Check out all the details on my website. I really, really would love to have you join the course, megancare.co.nz/course.